so good, isn't that?
Oh my god, that is just the most magical experience.
Alright, welcome everyone. Dr. Dave here with Synergy Wellness, Chiropractic and Physical Therapy. Today we have a patient here that has a really tight glute medius, glute maximus. That's your butt muscle. Then she also has tight hip flexors. So we're going to show you how we release those muscles with an active muscle release technique. Some people call it ART, A-R-T, active release technique. So what I'm going to have you do here is just bring your leg back here. Yep, stabilize yourself right there. And go ahead and swing your leg forward and down like that.
Oh,
good.
Oh,
yeah, it can be a little bit uncomfortable.
No, but it's
a good pain, right?
Yeah, it's like a good bad pain.
Yeah. If you've ever kind of dug into those trigger points in your glute, your butt muscle, you know what I mean. Right in there, we're just gonna release that muscle, glute medius and maximus. And those muscles both extend the leg back like this, like she's doing now, and they also abduct the leg like this and bring it away from the body. So go ahead. Good. And again. Good. And if you get neck pain, you can do this too. I did a video on how you can actually get rid of headaches and neck stiffness by doing this technique on your own at home in less than a minute, and it works. It's really effective. This is more effective than just doing a regular stretch on your own. I'm gonna help her out because it's a little tiring. Relax there. Okay.
Okay, I'm just gonna take a quick nap.
All right, now when you're ready and you're rested, we're gonna do a new spot here, okay?
Mm-hmm.
Go ahead.
Same thing?
Uh-huh.
Cool. Oh, that's different.
Yeah. We're on the glute medius. Good. So we've got a glute medius, a glute minimus, and a glute maximus, just to confuse things even more.
Yesterday was leg day.
Ah, okay. What'd you do? Just front and back?
Yeah.
Hamstrings and quads and glutes?
Yeah.
Okay. All right, relax there. Now I'm going to have you sit up and face me.
Okay.
Sit right on this cushion here. Okay. Now I'm going to loosen up her iliocostalus muscles, or the muscles along the spine right here, and the quadratus lumborum. So I'm going to have you cross your arms in front of you, and you're going to do a lateral tilt this way, and then you're going to bring that shoulder forward that way. Go ahead. Mm-hmm. Good. 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 Okay. Not as sore as the glute, is it?
Oh, I don't know.
Okay, good. Now we're going to go to this side. You're going to laterally bend to the right and throw your right shoulder forward to the left.
Gotcha.
Go ahead.
Oh, other way.
Yeah.
There's a moment.
Good. And we see here I'm applying pressure here and come back. Tissue pull and pressure, and she's actively helping me to release this tight muscle.
I like feel all the way up my back.
Up your mid-back?
Yeah, the third way though. Ooh.
Yeah, because we did the iliocostalus muscles, which run from the lower all the way up along the spine. Okay, stand up for a sec, see how that feels.
Feel much better.
Okay, well now let's get you adjusted, okay? So, lay stomach. So she was in a car accident, a couple of car accidents, right?
I've had
A
like
few
bad
car
luck.
accidents in 1 year, right?
Yeah.
Actually, in a couple of months, wasn't it?
Yeah.
In a few months, 2 accidents. So she's now recovering from that. That was last year.
And
Okay,
sitting
let's
doesn't
have this side up.
sitting doesn't make it any better. Oh.
The what?
Sitting does not make it any better.
No, and most people that have back problems, sitting doesn't make it better. Sitting is not great for our lower backs.
Yeah.
That's why it's important to take some breaks and do some stretches, you know, stretch your hip flexors, especially for your lower back. Make sure you have an ergonomic setup.
I
Relax
do.
here.
Yeah.
The other side up. It could be harder though with a being an artist.
Yeah.
To have an ergonomic setup when you're not at the desk.
I know when you're standing, it's not the great.
Yeah, sometimes you're not at a desk traditionally working on a computer, right?
Right. So my Air Maxes, whew, those are the best ones to paint in. Because I'm standing for so long. It's
Okay.
like the cushion, you know.
Are you painting right at eye level?
I try to. But sometimes I'm, bending.
Relax here. Good. Do you have a YouTube channel?
No,
No?
I should.
What's your website?
Just my name, Allison Dacre.
AllisonDacre.com. If you're looking for an artist, got a pretty impressive profile there. You've done some interesting things, right?
I have. I've done stuff, let's see, I've done stuff for 50.
For 50 cents, yeah?
I've done stuff, I think. I did this dope event with CEAS, Pop on
Yes,
CEAS.
okay.
And I did all of the artwork for Dropbox for
Okay.
a holiday party. It was
Artwork for Dropbox, see? So Allison Dacre, we'll leave it in the description below, okay? All right.
I have some concepts that I'm
What's
working. I have some concepts I'm working on.
Okay.
So I'm just putting this energy out there. I just thought. But do you remember the baby mural I did for Graffiti Hall of Fame where it's like, is it worth it? And the babies are sitting on a bunch of bottles.
No, I don't remember off the
It's
top
okay.
of my head, to be honest with you, I don't.
No, it's alright. So I think I'm gonna do that, but I wanna go and grab empty billboards. That was my idea behind it, or side of buildings.
How do you get that? How are you have to call the owners of the buildings?
Well, I could just go do it, or I can get in touch with the owners and try to work something out.
Hmm.
So,
The guy right across the street, Papaya King above there, used to have that painted, that section there. You know what I'm talking about?
Wait,
Right on
the
the
one
corner of 14th and 1st?
14 is the
Right above the Papaya King, you'll see a wall there, and I don't know if the mural is washed up or sort of not as visible anymore, but there's been murals there.
Alright, I'm gonna walk by. I don't wanna take a look.
It's on the second story, because the Papaya King is 1 story.
Alright. I drove around before I came.
You what?
I drove around before I came, and I
Uh-huh.
found a few of them. So I'm gonna
Around here there are.
Yeah, so and then empty spots that look really good. But I'm
There's a
like,
lot
"Whoa."
of them around here. There's the Michael Jackson mural. There's the Ruth Bader Ginsburg.
Well, I don't
around
want to.
here.
I want to respect the existing murals. So I'm thinking other spots that are big and empty. You know.
Yeah, that's a good spot. You should check it
All
out.
right, I'm gonna look and see.
Tuck your chin down, deep breath in, and blow all the way out. Good. And turn over on your stomach. So what I want you to do here is keep your legs straight. Raise one leg as high as you can. All right, good. And the other one?
Oh damn.
That one doesn't go up as high. That's
No.
you notice that obviously too.
I'm not
So
rising.
cross the difficult ankle over the easier ankle. And that's because her sacrum is rotated clockwise. Okay? Sacrum is that triangular bone that's suspended in between the pelvis with 4 ligaments on each side. So we're going to bring that across by bringing her leg across, back across here, and we're going to turn it from clockwise to a little bit more center, or the drive is going to be counterclockwise. Uncross the legs there. Now try it.
Was that better? It felt
Let's
better.
see. I'm going to check it. Okay, and check the other one. Better, but
Yeah.
still a little low. Slide up for me. A little more. Okay, now cross this ankle over here, and this should do it. Okay, now that should be normal. There we go. Much better. And the other one? Good. How's that feel?
Oh, heavenly.
Because you're about to take a long drive to upstate New York, sitting in the car isn't the best. So we're going to do a little flexion distraction here on her lower back. No pain into your legs, right?
No.
Good. Doing okay there?
Mm-hmm.
Feels like a good stretch, doesn't it?
Yeah, it does. It feels so good.
So if you're somebody that suffers from a pinched nerve, what happens is the foramina, that's what it's called, foramina, that's where the nerve exits from the spine. And the foramina, when they close up, they cause pressure on the nerves and irritate the nerves. So this method helps to, it's called foraminal gapping. It helps to open up the foramina so the nerve has more room to exit through the spine without any pressure or irritation to it. Take a deep breath in and blow all the way out. Now, So good, isn't that?
Oh my god, that is just the most magical experience.
And these things are much different than the Theraguns that people are buying online and stuff. I've had those used on me too. This is pretty intense. Kind of rattles your brain a little bit, huh?
It does, but it's always better when you do it at the end because I feel relaxed.
Okay.
And it's always, I just feel it's so.
After the adjustment?
Yeah.
Okay.
I feel like I don't want to say I can take it more, but does that make sense? Like it goes deeper into the muscle.
Okay, and you're also more relaxed after the adjustment.
Exactly.
I do it sometimes before the adjustment just because it's like a brick, trying to get through a brick wall. Some people are really stiff. You've been under care for a while now, so because of the accidents. But, you know, oftentimes people I'm just starting to see, they're so tight. I have to usually do this before I even adjust them. It makes it the adjustment very difficult too when they're stiff like that.
I just feel like butter now.
You feel that right there though? Turn your face to the left. And it might feel a little stiffer to the left. Put your ear in the middle of it. Yep. And then turn to the right. A little stiffer to the left or the right.
I think to the right. But they kind of feel.
Try it again. Here in the crease in the same spot.
Yeah, I feel it on the left, over here.
Okay. And turn it back to center. Tender right there? Not here. Okay. Just relax yourself here. Okay. Turn over on your back. You have a headache? Tender right there?
Yeah, but that feels so good.
And take a deep breath in and out. So these are just suboccipital trigger points underneath your skull bone there. A lot of people have them. Anybody that works on a computer or laptop, even if you don't, you're on your cell phone all the time, right? That's why we get these.
Oh, yesterday I had a terrible headache.
Did you? Okay.
Yeah. So when
it feels like you had a headache.
Oh, it was a whole nother world.
So you're taking a rental laser home today. You can, you know, use the laser right inside the nostril there, and that targets the SPG, sphenopalatine ganglion, which is exactly what migraine medications target. So you'll be able to inhibit that ganglion of nerves that trigger migraines naturally without any medication.
Oh, good, because you know I'm not for that.
And only once every 6 hours. So if you go home and do it now, or if you do it before you leave to drive upstate, you'll wait at least 6 hours before you do it again, okay?
And how long can I do it in each spot?
2.5 minutes.
Okay, cool.
And don't go over that because you're not going to help yourself. You're just going to negate the effect of the laser. You don't want to overdose the area, okay?
Gotcha.
Same thing with your mom, the same directions as before. If there's any additional spots or questions she has, she can certainly ask me and I can sort of describe where she would put the laser.
Okay.
But again, it would be 2.5 minutes at program 3.
Gotcha.
Tender right there?
Not, oh.
Right there.
Oh, yeah.
Okay, take a deep breath in and blow out. do a little Y strap. So everybody thinks this is an adjustment. This is not an adjustment. This is just traction, that's all. It's called a Y strap.
Wait, should I take my
We have
earrings?
people that come in here and specifically ask for this.
Should I take my earrings off?
Yeah, you might want to do that. It might be.
Yeah, I think. Yeah. Okay.
But it feels good, doesn't it? This is really good for people with tension headaches, people that have pinched nerves, disc herniations, disc bulges, spinal stenosis. It can even be a little bit helpful with. Good. Take a deep breath in and out. And again. Just wave your hand up if it's too much pressure, okay?
Not yet.
Okay. Okay, gently lift your head, drop it back. All right, great. Thanks for tuning in. Remember, www.alisondeka.com. We're going to put it in the description. And if you need artwork for your house, for your office, for your record label, for that bottle of tequila you're making in Cabo Wabo, or that bottle of wine you're making in California, she can do it for you. Thanks for tuning in.